I'm Dr. Joshua Derito, a family physician. Welcome to our this week's Wellness Health Services Health Talk. Today and this month we have been talking about the problems that affect the kidneys. And today I'll be discussing a condition that is called glomerulonephritis. Glomerulonephritis is an umbrella term that is used to identify inflammatory conditions that affect the filtering system of the kidney, which presents as a syndrome which represents with hematuria or blood in the urine. There will be proteins in the urine. There is hypertension or high blood pressure. There is edema or swelling, or especially of the lower limbs and also of the face. And there is a decrease in the renal functions. When you talk about a decrease in the renal function, we are talking about the filtering capacity of the kidneys is compromised. And this leads to presence of proteins in the urine and also presence of red cells in the urine, which are not supposed to be there. Commonly it's caused by a condition called IgA nephropathy, which is an inflammatory condition. It can also be caused by conditions like lupus, and it can also be as a result of infection, especially with the streptococcal group A infection. And this starts as a throat infection and is the most common cause, especially in children between the ages of 5 years and 12 years. So when a kid starts having fistula swelling, their pressure goes up, then high likely they could be having glomerulonephritis. And the purpose of this talk is to help us identify kids who could be having this acute glomerulonephritis, so that they are brought to the healthcare for emergency treatment. So usually when it is caused by streptococcal, it's an immune response from the infection with the streptococcal bacteria, and the infection will affect either the skin or the throat. And usually the fistula swelling and the hematuria will come 10 to 14 days after infection with the streptococcal infection. Then the manifestation will be high blood pressure, there will be blood in the urine, and most of it will resolve on its own. So as I said, the presentation usually is hematuria, blood in the urine, there is proteins in urine, proteinuria, and then there is also a decrease in the amount of urine output. When the blood pressure taken, there is a high blood pressure, there is edema, especially of the face. The children will wake up with the facial swelling. There will be periorbital edema or swelling around the eyes. They may have difficulty breathing. There is a decrease in the urine output, and also there is an impairment in the blood urea nitrogen, and there is an increase in the urine in creatinine when you do the urea and electrolytes. Diagnosis is usually through simple urinalysis, where you find the red blood cells in urine. You also find proteins in urine. You can also do a kidney ultrasound, whereby the kidneys are normal, and then the gold standard of diagnosis is renal biopsy, where you find that you can identify the glomerulonephritis through the biopsy tissue. The treatment of this is usually prompt treatment of the streptococcal infection with antibiotic, restriction of fluids, use of drugs to increase fluid output, diuretics like furosemide. There's room for angiotensin converting enzyme inhibitors, ACE or ARBs, and also supportive care, especially to support the kidneys, so that we do not worsen the process of kidney injury. So there's restriction in fluid intake, there is control of the fever, bed rest during the acute phase of the glomerulonephritis, and education, especially prompt treatment of streptococcal infection. So acute glomerulonephritis is an acute problem that usually presents in children between the ages of 5 and 12 years. The common presentation is facial swelling, and then the children will present with the blood in urine. And prior to this, there is a history of throat infection or a skin infection, which might just sometimes go unnoticed. But then when you inquire further, the parents will tell you of that kind of a history. The treatment for this is supportive, whereby you treat the infection, support the kidneys, avoid things that will increase the kidney injury, and also salt restriction and prompt attention in a healthcare facility. Thank you very much for listening to us. We encourage you to subscribe to our channel so that you continue learning with us on common health conditions and the measures that we can take to protect ourselves. Thank you very much.